But the other thing that people need to remember, especially now, it's almost spring break time, it's Easter time. People like to travel to warmer climates. The Central and South America and parts of Florida and Texas that have Zika transmission, they don't ever go out of the mosquito season because it stays warm there all the time, and so mosquitoes keep doing their life cycle and reproducing. So we're still advising, because there's still ongoing Zika transmission, pregnant women need to, if they have to travel to those areas, they need to use protection, stay inside, run the air conditioning to protect themselves from mosquito bites. There's still a risk for pregnant women if they get it that their child would have the birth defect of microcephaly, which the head is small, but that leads to other problems, and the child doesn't have normal development. So it's really just a tragedy for that family. Other people can get Zika when they travel, so it's important for them to pay attention. One of the challenges with Zika is about 80% of the people don't have any symptoms. But if you travel to Central South America, you need to use protection from mosquitoes, long sleeves, repellents, mosquito nets, air conditioning, all those things that reduce the risk of getting mosquito bites. If you do get mosquito bites and you come back and you have fever, joint pain, rash, conjunctivitis, which is infection in your eyes, give us a call, or call your doctor. Actually, we want you to call your doctor, and then they'll give us a call and we'll walk them through getting people tested. We've been testing people all through the winter because people travel and they come back and they don't feel well, or they're pregnant, they need to be tested. So they still have to get approval through us for somebody to be tested, but we do continue to do that testing and monitoring and education with those folks when they return. If you do travel to Central South America, you come home, just be aware when we start having mosquitoes out in our community, limit your exposure to mosquitoes. Again, that 80% of folks don't have any symptoms. We don't want you to come back and, what it would take to get local transmission. The right kind of mosquito would have to bite the person who has Zika and then go bite somebody else. And then we have local transmission. So we don't want that to happen. So we're continuously educating providers and people about what to do and what not to do even when they return home.